Hi, Gillian, Shania. Thank you so much for joining us today.
Hi, Jenny. Thank you so much for having us.
Yeah, excited to be here.
Yeah, it's such a pleasure to chat with you guys today. And for our listeners, would you mind perhaps chatting a bit about kind of your backgrounds and yeah, for us to get to know you a bit more?
Yeah, Shania, do you want to start us off?
Yes, uh, I am Shania Bhopa. I am a CIHR Vanier scholar, and in the last semester of my PhD at McMaster University, I specialize in women's health, community-based participatory research methodology, and I love problem solving through innovation. So whether it's building a children's book or an app for the emergency room, I absolutely love finding innovative solutions for the problems that we have here in Canada. And to that end, I personally just really experienced a difficult time understanding the economics behind why the HPV vaccine is not covered for every single person in Canada, and met Jillian through that passion and rage. And so I'll hand it over to Jillian now.
Cool. Yeah, thanks, Shania. My name is Gillian Cameron. I live in London, Ontario. I have a bit of a varied education background. So I went to what used to be Ryerson, but is now TMU, for photography and film. And then I later got a diploma from Fanshawe College for cybersecurity. So I have a background in a lot of different like arts, tech. I have landed and am now working in the video game industry. Um, so I do not have a background in health, women's issues, like nothing like that. I got into this solely based on a conversation with one of my friends. She was trying to go get the vaccine, discovered that it was $600 plus for all three dosages of the HPV vaccine. And that kind of started a fire under me and a bunch of girls in my friend group at how unaffordable and inaccessible this was to a large swath of people. I started a petition just as like a concerned citizen. And then I was lucky enough to get connected with a bunch of amazing women, including Shania, and we have created a coalition and a campaign to make the HPV vaccine affordable and accessible to everybody in Ontario.
That's amazing. And, I saw your campaign, more than 33,000 signatures, which is
Yes.
absolutely amazing.
Yeah.
And could you guys tell me a bit more about this campaign? Tell me more about your campaign to increase funding for HPV vaccination in Ontario.
Yeah. So I guess a TLDR, like I said, we're seeking to make the HPV vaccine free and accessible to everybody in Ontario. So the current guidance in place allows students in grade 7 through 12 and men who identify as gay, bisexual, and trans to access the vaccine for free. And we're seeking to ensure that anybody, regardless of gender or age, is eligible for free vaccination. So yeah, like I said, this just all kind of like popped up to me and I became familiar with this because of a conversation with one of my best friends. I started this 2 years ago, and all I was trying to do was just get traction and eyes on this issue through social media. So I was making TikToks, I was DMing like local politicians and news agencies on Twitter. And then one day I was lucky enough and I got connected with Kirsten from Swan Public Affairs, who is part of our coalition, just through a mutual connection that we had. And she was a complete lifesaver and continues to be a lifesaver. But she took this case on for us pro bono, and she has helped build this into what it is now. At the time I was a student, I had absolutely no connections to government or anybody kind of influential. I had never done anything like this before. So I was just trying to get somebody to take me seriously. And from the very first conversation that we had, she did. And I will always be eternally grateful for that because, yeah, she is absolutely like the backbone of our campaign and has like helped us build this into what it is now. And I've met incredible women like you and Shania. We in our campaign we have Dr. Gila Shapiro, Dallas Barnes of Rhea Health. Um, I feel incredibly grateful that something that kind of came out of that rage has landed me in such a beautiful spot that I'm able to connect with such amazing people through this. And we are so determined to see this through. We have a advocacy day planned later in November, where we're going to take this to Queen's Park and have this issue heard. And just if you had told me, back 2 years ago when I had started this, when I was just DMing like MPPs on Twitter that this is where we would be at now, I wouldn't have believed you. So I feel very optimistic. There's an appetite for this change, and a future for this campaign. And I am thoroughly, I believe that we will get this done.
Oh, that's amazing. I saw the original TikTok that you made that went
Yeah.
viral 2 years ago, and to see
Yeah.
so much traction come from just one TikTok, it's pretty amazing.
Yeah, the response to it was incredible. And it's connections like that. That's how I got connected with Shania, is because, she made a similar TikTok. Shania, I'll let you explain, but it was so organic. One of our mutual friends saw her TikTok and was like, this person has this exact same complaint that you do. You guys got to get in touch. But it's a pervasive thread through, women our age, others, but mostly women our age, that, this choice was taken away from them at a young age, right? And so we're all trying to take our reproductive and sexual health into our own hands now. Um, and it's tough. There are barriers to it. So,
It
Definitely.
is tough. And it's also just difficult when you see the statistics about how this is a preventable cancer. Like, full stop, period. HPV is responsible for nearly 90% of all cervical cancer. And, 1 in 5 women in Canada um, exper will pass because of a preventable cancer. And that is just so hard to swallow. And the health economics related to that, it's a $550 to $600 vaccination. The Canadian government, it really does not make sense financially for them to not be supporting every Canadian human being. And I hope that through this podcast and through the amazing women in the world that we push this through.
Definitely. And it sounds like so many people are trying to take control of their health now that they can. And for so many, because of the cost, it's inaccessible. They're not able to, even though they want to take control of their health. And that's such a big problem.
Exactly, and I think education's power. So if we have a few signatures every single day, in addition to people just reading a little bit about the HPV vaccine and and how supportive they can be in educating the next wave, educating their friends, talking about it at a dinner party, making this information as accessible as possible.
Definitely. Yeah. And, we've chatted a bit about how it's a lot of personal experiences that kind of started you on this campaign in the first place. And Jillian, you mentioned, you're not working in healthcare right now, but you're so passionate about this and it's from a personal experience. Was there any other experiences from yourself or maybe others that you'd like to share?
yeah, it, I'm a pretty tenacious person. So when I kind of get like a bee in my bonnet, I kind of go off and I'm like, all right, something needs to be done about this, right? I have a hard time letting things go that I feel passionately about, but especially when, when I made that TikTok and when I made the change.org petition, a lot of comments started flooding in from people with their own personal experiences. And so, originally it was a lot of people with similar stories. My parents opted me out because, there's a stigma around, this vaccine is related to STDs, and that's an uncomfortable conversation to have with parents vaccinating their 12-year-old children. Or, people were raised in religious schools and it wasn't even an option for them. So, a lot of stories like that were frustrating and just like, angering. But then it was also the other layer to that. When I started getting comments from girls as young as like 21 or 22 who would go in for a pap smear and come out with abnormal cells, and then, that escalated into cervical dysplasia, and that then escalated into cervical cancers. Or, yeah, girls as young as like 19 having to go have LEEP procedures done because of an HPV infection that they didn't know about. It's just horrific. And knowing that that can be prevented, to me, there is no excuse that this can't be done, and that this can't, um, that we can't prevent these like people from going through these horrific things. There is no excuse to me.
Definitely. And I saw a lot of these comments that you talked about, and so much. And also, so many girls were saying that their parents at the time, not as much information was available, which is why their parents opted them out at the time. But now that their parents are regretting the decision, but there's no way for them to make up for that without paying a significant financial fee. So,
And my exact story. You know, my mom is so supportive of what I'm doing now, and she has so much regret about her decision then. But it was a decision made by her, but it was also influenced by, you know, my friends that I grew up with. They didn't get vaccinated either. And it was parents that were kind of, you know, in this circle talk, being like, well, my doctor said maybe don't get it yet. They can get it when they're older. And then that influenced, you know, a group of 5 or 6 or 7 parents to not vaccinate their kids. And there was just, yeah, there was a ton of misinformation going around at the time. You know, I'm 29 now. I was born in 95. But same thing, same stories that come out. There was such bad misinformation going around about this vaccine at the time, and such a stigma that they did not want to talk about, you know, their little girls and their little kids going on to be, you know, people that had sex and that might contract something like HPV. And they didn't want to think about that. They didn't want to discuss it. And so they just decided this just doesn't exist and we're just not going to address it. And look where that's landed us.
right. And I think the advocacy effort so amazing. And if there's one message that you would like healthcare providers to hear, what would that message be?
Shania, I'll let you start on that one.
I would say that providing the HPV vaccine free of charge ensures health equity, where all Canadians, regardless of socioeconomic status, have access to preventative health care. And I think if we truly are thinking about empowering the next generation, and that's what we deeply all want, then we need to ask ourselves, how are we part of that conversation and how are we part of shifting culture? So even if you have a child come in and their parent is super hesitant about the HPV vaccine, as a practitioner, how can you take 2 minutes out of your day to break down those emotional or educational barriers that might exist for that parent to hop on over to the other side of the mountain and really see the benefits and long-lasting benefits of this vaccination for their child, whether whether they are a young little girl like we were, but also for every single child in Canada. This is not just a gender-specific vaccination.
Totally. And where I'll leave it, my mom was just diagnosed with ovarian cancer about 6 weeks ago. So this has been the hardest and most difficult thing that I have ever dealt with in my life. She just had major surgery. She just started chemo yesterday. And watching your loved one have to go through the pain and the fear that comes along with a cancer diagnosis is, I would never wish it upon anybody. It is one of the most horrific things that I will probably ever go through in my life. And to know that we have the potential to save families from going through what my family is going through by giving people access to this vaccine, it is mind-boggling to me that we would not take that step and that we wouldn't fight for that coverage. This is the only vaccine that I'm aware of that prevents cancer. So to not offer that freely to those that need it and that can benefit from it, to put it mildly, it's a shame. It is like a blight that, like, we should all feel shameful for that. So I would ask those that have a voice to bring about a positive change to use that voice, like you're doing with your podcast, Jenny, and those in power to make the change and to do the right thing and to expand the coverage and to spare families from what I'm going through with mine right now. And our coalition will continue to advocate for that until the ask is done.
Definitely. And, if somebody like myself, if medical students or physicians or people who are completely outside of healthcare, if we want to get involved or help your campaign along, what can we do?
Yeah, I mean, you can go and sign our petition. It's change.org/HPV. You can also contact me, Shania, on social media. Our social media handles are just our first and last names, Gillian Cameron, Shania Bhopa. And we are always happy to have conversations, bring people on board into the coalition. Like I said, Shania and I just got connected through a mutual friend. We are always more than happy to have chats and bring people on board. So
Amazing. Thank you both so much. This
Thank
is
you.
so helpful and just learning about your stories and what brought you here. And, it's amazing that we have a vaccine that prevents cancer, and it's a message that we really need to pass along. So thank you so much for your time today.
Thanks,
Thank you for
Jenny.
all that you're doing.